Dear all, a few days ago, after a long decision-making process, I decided to post a comment on SARS-CoV-2, COVID-19 on YouTube. I did this in German to primarily reach out for friends and colleagues, but also to all those who might still be willing to apply common sense. I was aware that this might result in personal offense and shitstorms too, well, even might challenge my professional credibility. But I decided to follow my conscience, to comment on it and to reflect critically the actual decision-making process fueled by so-called experts, politicians and press people. As I clearly stated, and I do this now again, that is my personal view, without any relation to a company or institution, so that I would be the only one to be blamed in the case of. After going online, just check Haditsch and COVID-19 on YouTube, this clip went viral. 260,000 hits after 6 days only, and this limited to the German-speaking area. But as there were many requests to translate this into English, I decided to record an adapted clip in English, which in some instances differs from the previous one, as data and conditions focused on Germany might not be applied in the rest of the world. At this point, I also want to apologize that I'm going to read this statement down, as I am no native speaker and I try to adhere to exact wording. Nobody, including myself, knows pure truth, but politicians act if they did. It is my utmost goal to discriminate in between facts and wrong interpretations. I try to avoid the word fake news in this context, as I don't want to blame anybody to do that by intention. My hope is that as many people as possible might be able to get their own picture on the actual situation, and we all may benefit from this under the bottom line. SARS-CoV-2 is a new virus which jumped over, most likely originating from bats, in the last quarter of 2019 in Wuhan, China, to the human population in a way yet to be discovered. All figures concerning infectivity, transmission rates, case fatality rates, that is how many die out of those infected, as well as the so-called basic reproduction number, that is the average number infected by one infected person, depend, amongst other factors, on population density, hygiene and prevention measures in place, the age and the quality and quantity of the local healthcare system respectively. As nobody, including the WHO, the World Health Organization, had figures about the number of infected people, all published figures on infection and case fatality rates is simple guessing. Estimations on the real number of infected people varied widely in between 4-fold and 30-fold of the numbers published and depend on the country affected. So, just an example. 10-fold more infections means, on the one hand, that the number of reported infected people is only 10%, or the real number is 10 times higher, but also that the case fatality rate may be 10 times lower. In addition, we should recognize the phenomenon of SARS-CoV-2 labeling, which means as soon as somebody is tested positive, each and every further impact on health, including death, is mandatorily explained by and attributed to this agent only. In many countries and organizations, experts warn not to compare COVID-19, which is the disease triggered by SARS-CoV-2, with influenza, as this might lead to a trivialization of this new disease. These people have not recognized the severity of influenza still. This is a dangerous situation, as there were and still are seasonal influenza epidemics annually. So if we judge the actual global response to SARS-CoV-2 as adequate, shouldn't we accept, well, even request the same procedure each year due to influenza, at least in countries with low vaccination rates? Actual figures on SARS-CoV-2, which is today, on the 5th of April 2020, roughly 1,200,000 cases and 65,000 deaths attributed to COVID-19, results in hysteria and panic. And everybody accepts drastic interventions by politicians who don't care for massive collateral damages, which are not economically only. In contrast, we widely accepted all the impact by influenza. According to WHO data, there are at least 20 million cases and 250,000 deaths annually. Taking this into account, actions applied actually are not justified, and even basic ethical rules are being ignored. This way of thinking is not only stupid, but even dangerous. As we talk about a global phenomenon, decisions should not only mirror the responsibility for those actually sick, but also for global economic and healthcare systems we are in desperate need of in future. All those measures which are actually required, which are hand hygiene with hand washing and disinfection respectively, to avoid close contact with elderly or persons with underlying diseases, to stay at home when sick, not to cough, spit or sneeze openly in the public, are neither new nor unique for the actual situation, but were recommended already for decades without sufficient support by governmental organizations. And in most regions, the United States of America being an important exception, there was also only little public support for influenza vaccination too. Even if we estimate a protective effect of 30% only, this would result in an equivalent decrease in flu-associated cases requiring intensive care or respirators, respectively. And where were those urgent calls for influenza vaccination, at least of the high-risk community, while anticipating the pandemic COVID-19 wave? While checking the tragical situation in Italy, France, Spain, or the United States, we also must take into consideration that truncating the public healthcare systems had and still has a huge impact on the availability of intensive care units and ventilators. And in addition, lacking high-quality hospital hygiene, there is also a difference in hospital-acquired infections, which frequently also translates into case fatality rates, especially when highly resistant organisms are involved. For instance, as compared to Germany, with more than 30 ICU beds per 100,000 inhabitants, Spain, France and Italy, with 10 to 12 beds per 100,000 inhabitants only have 40% of Germans' intensive care capacity. Just as a mathematical model, if we focused our calculations on COVID-19 only, the need of 20 breathing units would leave 10 beds still available in Germany, while we would be forced to watch 8 patients dying in other countries mentioned. On 4th of April, roughly 50% of the German intensive care beds were available. Within 24 hours, the number of available IC beds could be extended to the number of 17,500. According to the ECDC, the European Centers for Disease Control, data in 2015, France reported roughly the double and Italy the fourfold number of hospital-acquired infections as compared to Germany. So, under the bottom line, it is simply not possible to compare this data while ignoring these co-founding factors. Quoting the message, actually health has top priority, simply ignores the fact that we should be able to afford health in future too. As the healthcare system is based on economy, somebody will have to generate the income needed to pay for it in future. Thus, it is careless that politicians and their consultation teams ignore that they destroy the global economy by their decisions. The frequently posted protection claim, "We did everything," includes by definition that they did every nonsense too. Taking into account all possible chain reactions simply does not allow to follow principles of social romanticism. We need to protect each and every life. But the decision makers have the damn duty to broaden their horizon to a holistic approach, including the consequences on a middle and long range. Thus, in addition to virologists, counseling boards imperatively must include various specialties like global economists, specialists in ethics, epidemiology, psychology and communication skills on an equivocal basis without any pressure by moralists. Herewith, I want to blame merely all the governments with blatant failure. Yes, there are very few exceptions like Sweden. Mitigation strategies. This is the strategy to slow down infection rates, may be justified in regions to gain time to adapt weak healthcare systems which are likely to collapse under the amount of new cases associated with an unchecked evolution of this pandemic. But even then, economical considerations must be taken into account. Of course, facts like multifocal introduction, as it happened in northern Italy, for instance by Chinese guest workers, or Tyrol, Austria and Switzerland by huge numbers of international tourists, the longer-lasting ignorance of the need to protect risk groups, which are elderly persons or persons with underlying diseases, in combination with the challenge of an even under standard situations chronically overstrained healthcare system may easily disbalance medical services, regrettably resulting in an increasing number of severely sick or even deaths. To my great surprise, not only outstanding virologists, but highly respected institutions like the German Robert Koch Institute and even the WHO present numbers on infection rates and case fatality rates as if they were facts, without having the slightest idea of the real number of the infected persons. At that time, the one and only reliable data pool was an inhuman field trial when Japanese officials locked up all passengers and crew members on a cruise ship, Diamond Princess, irrespective of the fact whether they were sick, just infected, or at that time non-infected at all, without providing protection gear or instructions how to apply basic hygiene measures in the initial phase. And we need to take into account that cruise ships, as so-called contained compartments, are proven high-risk environments for the transmission of not only but especially aerogenic infections based on experiences with influenza or measles, with the overlap to an overrepresented population prone for more severe disease. And even under the combination of these disadvantages, co-founding factors for passengers and crew, amongst 3,700 persons, there were only 712 infections, which were not even 20%. And actually, 11 deaths represent roughly 1.5% of the persons infected. Yes, nowadays there are some additional data, for instance from Iceland, and more prevalence data actually generated in various countries. According to data available so far, the vast majority of severe cases is seen amongst the risk groups mentioned, sparing out healthy children. And despite these findings, decision makers indicate that there are only two opposite strategies only, with exposure of everybody, irrespective of personal risk factors on the one hand, or a complete shutdown on the other. Trustworthy estimations indicate that only roughly 10% of the working people belong to one of the risk groups, so that it should be easily manageable to provide strict protective isolation measures for them, while keeping the others in the working process, thus not jeopardizing the global economy. And even people like me, who are no specialists of economy at all, easily realize that all those financial recompensation programs generously proclaimed by different persons or institutions are outweighed by far by the incredible collateral damage which is very likely to result in a global disaster, including even the wealthiest countries, as even those depend on functional global supply chains. Furthermore, even if some companies may survive, there will be far less people left who can afford to buy available products. Those living in secure social systems tend to ignore what actual shifts in economy already mean for those lacking even basic social services. Hundreds of thousands of people, including their families, desperately depend on a system that grew over decades and may suffer severely or even die if this heavily interconnected system takes a substantial turn. But even in our rich countries, we already see that COVID-19 changes increasingly impacts daily life, including mental health, or the treatment of patients we took for granted. Even here, we need to include delays in treatment, for instance with myocardial infarction or stroke, or visits in doctors' offices, depression, or in the worst case suicides, into the medical collateral damages, not to talk about those in economy related to crashes of all sizes of companies, exploding figures of unemployed people, and disruptions of essential supply chains. Streamlined media positions and endless reports of horrific scenarios may calm people for a certain period of time, but are not the means to regain trust. And I really wonder how politicians will manage to find a plausible exit scenario without losing their face. So quite likely, under the bottom line, if the pandemic should turn to good, they will take it as justification for the drastic actions taken, and if not, they may blame the public for non-adherence to their rules. But isn't it a paradoxon that they support hope in herd immunity while sacrificing the global economy to take every action to block out exactly this development by any means. They too will have to accept that replacement of natural immunity by new developments, for instance licensed vaccines or drugs, simply cannot be achieved within a reasonable period of time. Furthermore, according to experts, Western healthcare systems may also lack essential drugs, including antibiotics produced in Asia, as some of them simply won't be available due to broken supply chains with incredible impact on global health. Let us summarize the facts. SARS-CoV-2 is a new coronavirus associated with a broad spectrum on manifestations in humans, from asymptomatic carriers to life-threatening disease. Age and underlying diseases foster an aggravation of the clinical course. Hand hygiene has a proven protective effect. PCR tests, that is detection of genetic sequences specific for SARS-CoV-2, are indicative for infection, and the clinical outcome depends on the medical infrastructure too. Measures like a shutdown will inevitably lead to a global economic disaster. The following aspects still need to be checked. We don't really know figures on infectivity and case fatality rates, as a denominator, that is the real number of infected people, is not known yet in most countries. Social distancing and closure of schools haven't proven a benefit on a long range. In addition, there is no proof that borders being closed after the agent has already started to circulate in a country is beneficial. The same is true for screening of asymptomatic persons. We still don't know whether the pandemic will follow a seasonal pattern, as well as the question whether antibody checks offer a trustworthy hint for immunity. And there is no scientific proof that masks are protective when used by healthy persons. Taking into account the whole impact of a shutdown, it seems very unlikely that there may be any justification for that. So based on facts and indicating questions still open, I would like to make an urgent call for action. The time for country-based decisions is over. A global threat as this pandemic needs a global solution. This, for instance, could be realized by a global economic and health forum similar to the one organized each year in Davos, Switzerland, with global political leaders, experts in virology, epidemiology, psychology, ethics, and global economics, negotiate on a global solution on how to minimize the collateral damage, not only on a short, but also on a medium to long term. Please be aware of the loss of trust, as day by day hundreds, if not thousands, of small to medium enterprises are destroyed, and of the urgent need to re-establish confidence into future, as this is indispensable for the decision makers and the ones they love too. And to all of you, stay healthy and try to keep your optimism, as well as the sense of humor needed so much nowadays. Thank you for listening, and warm regards to all of you.